Hi everyone, today we're tackling one of the most intimidating classes in nursing school, pharmacology. Yes, the one with a million drug names and side effects. But don't stress, I've got your back with proven study tips that actually work. First of all, approach your studies in nursing school like you only get one shot. And it's not just for pharmacology, that's for any course in nursing school. Have a mindset, I only get one shot. Sure, you can retake the course if you fail, but do you want to? Do you want to go through all that stress, time lost, momentum killed again? Set your mind on doing it once and doing it right. Treat every lecture, every study session, every exam like it's your only chance. Because when you commit like this, you unlock a different level of focus and drive. Make it count like your future depends on it, because it does. If you're juggling nursing school with kids, a job, family responsibilities, listen closely. Something's got to give. This is the time to put everything else on hold. Forget about doing dishes, cleaning the house, or weekend outing with friends, and delegate. Ask for help. Rally your support system, friends, family, church groups, neighbors, anyone willing to lift the load. Let them know it's temporary. Tell them you'll pay them back after you pass your NCLEX. And you're not being selfish, you're being strategic. Nursing school demands your undivided attention and most of your waking hours, and difficult courses like pharmacology especially. And it's not something you can squeeze in. Build your life around it. Make it your priority and protect your time like your future depends on it, because it does. Whenever you study anything in nursing, and pharmacology specifically too, whether it's a medication or disorder or procedure or anything, you need to ask yourself two questions. What does it mean for my patient? And what does it mean for me as a nurse? Those are the two main questions you should always be able to answer, because the nursing questions on the exams, whether it's your unit exam or NCLEX, will be giving you patient scenarios and asking you something about either the patient or the nurse's actions. And if you can answer those two questions, you are well prepared. Let's say I'm studying anticoagulants, such as heparin. After reading all about heparin, I try to answer the two questions with my own words. What does it mean for my patient? Here, I like to imagine my patient. Let's say I have a 65-year-old Mr. Green, and if my patient is on this medication, what does it mean for him? That means he's at risk for developing blood clots, and that's why he's given this medication probably. And therapeutic actions of these medications is prevent blood clots. So I already have a clear picture in front of me. However, I understand that this medication will increase my patient's risk for bleeding. And so Mr. Green should be carefully watching signs of bleeding, such as bruising, tarry stool, low blood pressure, and reporting any of these signs to the provider. And he should also be careful moving around to prevent injury, not to bump himself on something, which may increase the risk of bleeding. Now, that's for the patient. Second question, what does it mean for the nurse? And I am the nurse. Here I like to imagine I'm the nurse for this Mr. Green. I like to pretend that I'm a nurse taking care of my patients. As a nurse, I understand that heparin is an anticoagulant given to prevent clots, like we already mentioned, commonly administered for patients with pulmonary embolism, atrial fibrillation, and I will be checking my patient's APTT lab results to make sure they are within the target range. I will also review my patient's history to make sure there isn't some contraindication for administering heparin, such as some bleeding disorder or maybe recent surgery or allergy to heparin or pork, history of HIT, and I will have a conversation with the provider if I find any contraindications in Mr. Green's history. I will be administering heparin either subcutaneously, perhaps in his belly, or as an IV drip, depending on the order. The drip is usually a weight-based order, so I will make sure to go and weigh my patient ahead of time. And you can watch my dosage calculation video on how to calculate heparin dosages, by the way. I will also be watching my patient for signs of bleeding, but in addition to what the patient can observe and report, like bruising and tarry stool, I can also check the lab results for low red blood cell count, low hematocrit and hemoglobin levels, and all of these will indicate a potential blood loss, and it may give me a hint on maybe my patient is experiencing an adverse effect of this medication. I will educate my patient to avoid injuries and report signs of bleeding. You see how if you answer these two questions, you know the drug and can answer any NCLEX question about it. Let's try a couple of questions right now so you can see. First question, you are providing care for the following 4 patients. Which patient below would be at high risk for developing adverse effects of heparin drug therapy? A 49-year-old Miss Blanca with uncontrolled atrial fibrillation. B, a 50-year-old Mrs. White with a pulmonary embolism. C, a 36-year-old Mr. Brown with alcohol withdrawal. Or D, a 65-year-old Mr. Green who is post-op day 1 from brain surgery. First patient has atrial fibrillation. I remember that heparin is given for atrial fibrillation, so she probably needs heparin to control blood clots. So that patient is not a good candidate to be at a high risk for developing adverse effects. Second patient has pulmonary embolism. Again, I remember that pulmonary embolism is another condition that may need heparin, so this patient is not at risk but probably needs it. Alcohol withdrawal for Mr. Brown is not one of the contraindications. And the last patient has a recent post-op after brain surgery. And I learned that heparin increases risk of bleeding, and contraindications for administering heparin are bleeding disorders, recent surgery, and some allergies. So this patient is at risk for developing adverse effects of heparin because we have a recent surgery. And this is how it looks on the exam. You will be tested with scenarios that require application, not just memorization. Let's try one more question. You administered a bolus and initiated a heparin drip for Mr. Green. What will be your next important nursing action? A, collect hemoglobin hematocrit levels in 6 hours per protocol. B, collect an INR level in 6 hours per protocol. C, collect APTT level in 6 hours per protocol. Or D, collect red blood cell level in 6 hours per protocol. And I remember from studying and reviewing what nurse will do when administering heparin is that APTT is the specific lab for heparin. So I know the correct answer is C. Do you see how in both of these questions, success depends on answering one of two things? Either you need to know something about the patient in relation to therapy, or you need to know the correct nursing action to take. That is why I always teach students to study pharmacology through the lens of the two guiding questions. What does this mean for my patient? And what does this drug mean for me as a nurse? When you ask the first question, you're thinking like your patient. You focus on what they experience, the therapeutic benefits, the side effects that they should watch for, the lifestyle changes or safety precautions they need to follow. For example, will my patient on anticoagulants bruise easily? Should they report black tarry stools? When you ask the second question, you are putting on your nurse's hat. You're becoming a nurse and you're thinking like a nurse. You consider your responsibilities. What labs do you need to check? What contraindications you must screen for? How to administer the medication safely? And what education you should provide. For example, do I need to check APTT before giving the next dose of heparin? Do I need to monitor for bleeding? Should I hold the medication if the blood pressure is too low? This dual question framework transforms pharmacology from random facts into meaningful clinical decision making. And here's the best part. If you can clearly answer those two questions for any drug, you will be ready for both your exams and your real-world nursing practice. Because Ultimately, every pharmacology question boils down to either how does it affect the patient or what is the nurse's best action. Next, let's talk about memorizing everything. Students often ask me about some methods and tricks for memorizing everything. Memorizing is important, but don't memorize everything. Group it, organize it, make sense of it. One of the biggest mistakes trying to memorize every single drug. Don't do it. Instead, group medications into drug classes and learn one or two prototype medications as a representative of the drug group. If you know one ACE inhibitor, you can recognize others. Many times they will end with the same suffixes. If not, you can still recognize them by other ways that they're named. For the prototype, learn class and suffixes that help you recognize drugs, like olol for beta blockers, mechanism of action, how does it work, therapeutic effects, what are we expecting to see, how will it help my patient, adverse effects that are common to the class and uncommon but severe, contraindications, and common or severe drug-to-drug, drug-to-food, and drug-to-herb interactions. For example, let's say I'm studying a drug, atorvastatin, from a class of drugs known as HMG-CoA reductase inhibitors. These drugs are used to lower cholesterol levels in the blood. Class and suffixes, what do I need to remember? So the class, they belong to a class of statins, and the suffix that relate the medication in this class is statin, like atorvastatin, simvastatin, lovastatin, and the other statins. The mechanism of action, or how does the medication work, is it inhibits the enzyme HMG-CoA reductase, which is involved in cholesterol production. Liver produces most cholesterol while we sleep, and taking certain statins like simvastatin, lovastatin, fluvastatin at night help them block cholesterol production during this peak period. Now, moving on to therapeutic effects. What are we expecting? How will this medication help my patients? It will treat high cholesterol or hypercholesterolemia with the purpose of prevention of cardiovascular events. We're expecting lower levels of LDL cholesterol. That will be our therapeutic effect. What are some side effects or adverse effects that are common to this class and uncommon but severe? Common include muscle fatigue, pain, digestive issues, headache, and dizziness. Uncommon but severe are liver damage, rhabdomyolysis, which can lead to kidney injury. And this drug is contraindicated if there is an active liver disease, pregnancy, or breastfeeding. Interactions, it can interact with antimicrobials, increased toxicity of statins, anticoagulants, there's a risk for bleeding, grapefruit juice, there's increased risk of toxicity, and alcohol, increased risk for liver damage. Now, knowing these details about atorvastatin, I have a general idea about all drugs in this class. And even though there may be small variations from drug to drug, for example, some statins are best taken in the evening, and for some it doesn't matter when you take it, the general information about them is the same. So no matter what statin question you get on the exam, you will be able to answer it correctly. You know one, you know them all. Now remember, once you studied the drug, go back and answer the two main questions. What does it mean for the patient, and what does it mean for me as a nurse? Making sure you actively recalling the information that you just put in your head. This is not the only way to organize information by class of drugs. You can organize information in other ways too. For example, you might group antibiotics by their adverse effects, like which ones cause nephrotoxicity, which ones cause ototoxicity or bone marrow suppression. Or you might organize insulins by their onset, peak, and duration times, which makes it easier to connect them to nursing care. The goal is always to see patterns and make the information meaningful instead of drowning in random details and memorization. And here's the beauty of organizing information this way. Patterns start to jump out at you. For example, when you look at antibiotics grouped by adverse effects, it becomes obvious that all antibiotics can cause gastrointestinal issues like nausea and diarrhea. Once you see that big picture pattern, you only need to pay closer attention to the unique or severe side effects that set a specific class apart, like tendon rupture with Cipro from fluoroquinolones, or ototoxicity with aminoglycosides. So organizing information doesn't just make it easier to study, it helps you focus your brain on what really matters for safe nursing practice. Here's a couple more examples how students organized their antibiotics adverse effects to help them learn. In addition, you can color code these charts and tables for additional memory help. When you're learning adverse effects, don't just memorize a giant list. Instead, you need to pay attention to three things: common adverse effects, rare but severe adverse effects, and unique adverse effects. So common adverse effects, they're things you will see with a lot of medications, like GI upset, nausea, vomiting, diarrhea. Almost every antibiotic can cause this, and honestly, many other meds can too. So it's important to know, but it won't help you differentiate one class from another. The rare but severe adverse effects, these are the ones that can be life-threatening or require immediate nursing action, like Stevens-Johnson syndrome with sulfonamides, like anaphylaxis with penicillins, or rhabdomyolysis with statins, hepatotoxicity with Tylenol. These are the ones NCLEX and clinical practice will expect you to recognize quickly. And then the third group is unique adverse effects. These stand out. These are effects that are highly associated with particular drug or class. These are the ones that help you pick the right answer on the test. For example, tendon rupture with fluoroquinolones, or ototoxicity with aminoglycosides, Redman syndrome with vancomycin, gingival hyperplasia with phenytoin, or cough with ACE inhibitors, the sulfuram-like reaction with metronidazole mixed with alcohol. So when you organize information, don't waste your time treating common GI upset the same as rare or unique adverse effects. Don't group them in just one list and trying to memorize it as one cloud. Make sure you separate them into common, rare but severe, and unique. Learn the patterns. Assume GI upset is likely, but know which drugs have the unique or dangerous effects that set them apart. That's how you study smart for both exams and patient safety. If a medication has serum levels or an antidote, you absolutely need to know it. Why? Because this is directly tied to patient safety. If the level is too low, the drug doesn't work. If the level is too high, the patient can become toxic. We call it narrow therapeutic index. That's why drugs like digoxin, lithium, and phenytoin have therapeutic ranges that we monitor closely. And if toxicity occurs, you need to know how to act fast. And that's where antidotes come from. For example, vitamin K is for warfarin, protamine sulfate is for heparin, naloxone for opioids, and flumazenil for benzodiazepines. If, when you study a drug, there is an antidote that is listed, please remember that antidote, memorize it. When you're studying, flag these meds that have antidotes, put them in a table, and have that table available to you throughout your house. Put it on doors and counters and anywhere you can review it constantly. These are high yield medications for exams and critical for clinical safety. And again, organize information into graphs, tables, concept maps for easier memorization. Now, these are not the only labs that you need to know, the serum level labs. To keep your patient safe, you also need to connect medications with the routine labs that show organ function and toxicity. For example, electrolytes like potassium, magnesium, are critical because imbalances can cause arrhythmias, especially in patients on digoxin or diuretics. It can cause other issues, even seizures. CBC values matter. Low hemoglobin hematocrit could mean bleeding from anticoagulants, while low white cells can happen with chemotherapy or some antibiotics even, or other immunosuppressive medications. BUN and creatinine is another lab, tells you about kidney function, which is key because impaired kidney cannot clear drugs like aminoglycosides or digoxin, leading to toxicity. And we frequently need to assess kidney function. So you will need to know BUN and creatinine values. And don't forget liver enzymes. They help you spot hepatotoxicity early, which can occur with statins, isoniazid, acetaminophen overdose, and liver enzymes are AST and ALT. So remember, it's not just about serum drug levels, it's about the bigger lab picture that tells you if toxicity is developing in your patient and how to keep your patient safe. Let's look at another practice question. A patient with heart failure is prescribed furosemide and digoxin. The nurse notes a potassium level of 2.8 and digoxin level of 2.5. Which nursing action is the priority? A. Encourage the patient to eat foods high in potassium. B. Notify the healthcare provider immediately. C. Hold the evening dose of furosemide. Or D. Teach the patient to check their pulse before taking digoxin. Take a moment to think. And the correct answer is notify the provider immediately. Severe hypokalemia greatly increases the risk of digoxin toxicity, which can cause life-threatening arrhythmias. And not only digoxin toxicity, but hypokalemia by itself can cause arrhythmias. So provider will likely order potassium replacement and possibly hold or adjust digoxin here. And here's the key. If you don't know that normal potassium range is 3.5 to 5, you won't recognize that 2.8 is dangerously low. That's why memorizing normal lab values is so important. It allows you to interpret the numbers in context. And nursing questions are not going to tell you necessarily patient has hypokalemia or patient with low potassium levels to hint at the right answer. Nursing questions will be formulated just like this. It will give you a number and you have to figure out, is it high, is it low, is it normal? So always remember, electrolyte levels must be memorized. And always remember, potassium is a major player in cardiac safety. Anytime you see a patient on digoxin and potassium wasting diuretic like furosemide, think red flag. Low potassium makes digoxin far more dangerous. And remember, severe hypokalemia like 2.8 significantly increases the risk of life-threatening digoxin toxicity. The nurse must act quickly by notifying the provider, anticipating orders for potassium replacement, and possibly holding digoxin. Look at option A, dietary teaching. This is helpful, but it's not urgent. Yes, it will help. However, we need to act urgently. How about option C, holding furosemide? It addresses one cause of potassium deficiency, but it doesn't treat the acute risk. How about option D, teaching? That is very important, but it's not a priority in a crisis situation. So always choose your options by priority. And remember, potassium and digoxin are tightly linked. Low potassium makes digoxin toxicity much more likely. Very, very important to know your lab values. And here's just a few of the high yield lab values you need to know for pharmacology and for NCLEX. But don't stop here. Start building a table like this for yourself and keep adding new labs as you learn them. And here's my tip. Hang it everywhere. Put it in your bathroom, your kitchen, above your desk. So every time you brush your teeth or grab a snack, you are reviewing and reviewing and reviewing. If you see it multiple times a day, pretty soon you won't even have to try. You will have it memorized solidly. Now, one thing to keep in mind, These exact numbers may vary a little bit. They can change depending on the hospital lab. Labs are different and they have different reference ranges, or even they can be different from textbook to textbook. Don't stress about the tiny differences. On exams, they're not going to give you borderline values. They're going to give you something either obviously high or obviously low, so you can clearly recognize what's abnormal and what's not and act on it. And this leads us to the next topic of this video, active versus passive learning and active recall. Active recall or active learning is different from passive learning. So what is passive learning? Passive learning is when you are receiving information without really engaging with it. And it doesn't matter what type of learner you are, it's all the same for everybody. Passive learning often includes reading textbooks or notes, listening to lectures without taking notes or asking questions, highlighting large amounts of text, watching videos without pausing to review or practice questions. So what is happening? Why is it passive? Your brain is absorbing, but it's not necessarily processing or applying the information. It feels easy, but you're not retaining much. And remember, in nursing questions, we will mostly ask you application type questions, not necessarily knowledge-based questions. Those are too easy. Those are in the past. But applying knowledge to a situation, that's what we are after in nursing. So we're going to use active learning for pharmacology course, and for any nursing courses that will be helpful too. Active learning is when you interact with the material. Force your brain to retrieve and apply and explain the information. Again, it doesn't matter what type of learner you are. On a test, you will be expected to retrieve information out of your head and apply it to the test question. Examples of active learning that you can implement when you study are quizzing yourself with flashcards, teaching a concept to someone else, maybe your dog even if there's nobody else, doing practice questions, creating concept maps or charts, applying information to case studies, participating in group discussions or simulations. When you're actively learning like this, what is happening? You are building stronger memory connections and you're increasing your understanding. It's harder work, much harder than passively listening to a video or a lecture, but it actually helps you learn and retain information that you can later take and retrieve and answer exam questions or apply to an actual patient's scenario. And guess what type of questions you will see on your nursing exams? Once again, it's going to be application questions. And if your general studies before nursing school, you mainly had knowledge-based questions, like how many chambers does a human heart have? The answer is 4. This is knowledge, right? I know it's 4. That's it. You either know it or you don't. In nursing school, once again, you will be hit with much more complex questions, not just to know the fact, but apply the fact into clinical situation. Active learning beats passive learning every time. Nursing exams are scenario-based. There's always going to be a scenario whether something's going on with the patient or something that nurse has to do. You will need to apply knowledge, not just recall it. So let's talk about active recall tips. What can you do to help you learn? Quiz yourself without looking at your notes. Make sure to use repetition. Review information a little bit every day instead of cramming it all before the exam. Expose your brain to the same information at least 3 times. For example, once I read the chapter, then I listened to the lecture or did some class activities, then I memorized it, and finally, and most importantly, I tried to recall, to retrieve information from my head. And practice daily. One of the best ways to retain pharm is to teach it to someone else. Grab a classmate or even your dog and explain out loud or even in front of the mirror but it's important to explain it out loud how the medication works. If you can teach it simply, you know it well. And think about it. If you are a nurse, you will be expected to educate your patients about the medication they're taking. Might as well start practicing now and kill two birds with one stone. Not only you will do great on the tests, but also will become a very knowledgeable, professional, and safe nurse. Another very helpful tip for you, use mnemonics and visuals. Mnemonics and visuals are your best friends in pharm. They turn impossible lists into simple patterns you can recall under pressure. For example, this mnemonic refers to classic anticholinergic effects: can't see, can't pee, can't spit, can't poop. And another one next to it is to remember toxic levels of anticholinergics: mad as a hatter, blind as a bat, hot as a hair, dry as a bone, red as a beet, and full as a flask. This helps you retain that information easily and more playfully. Also, don't underestimate visuals. Draw out drug pathways, watch animations, make flashcards yourself. Not necessarily buy flashcards, but make them yourself. You will help your brain retain that information better. One of the best ways to make pharmacology stick is to study it in short bursts throughout the day. For example, listen to recorded lectures or study notes while you're commuting or driving. This turns otherwise wasted time into active review. Carry flashcards with you, either a small stack in your bag or digital cards on your app. Even 5 minutes in a waiting room or before class or while you're in a bathroom, it's very valuable. Use study apps that give you practice NCLEX-style questions on your phone. Quiz yourself. Remember, the key is repetition, repetition, repetition. Every time you expose your brain to the same information over and over again, even just a few minutes, you strengthen the memory. And a few mini sessions each day will add up to hours of review each week without even scheduling extra study blocks. One of the best ways to make pharmacology stick is to connect it to real-world nursing scenarios. For example, when you are giving opioids post-op, you don't just memorize respiratory depression as a side effect. Instead, picture yourself in a hospital, you're a nurse, watching your patient's respiratory rate and oxygen saturation. And remember, the antidote is naloxone. That mental picture ties the drug to the actual nursing action you will take, and you will remember it better. Another example is insulin teaching. Don't just memorize onset peak duration. Instead, think about your diabetic patient. When insulin is peaking, that is the highest risk for hypoglycemia. So that's when you will be watching closely, checking blood sugar, educating the patient to eat on time, providing snacks or meals. And here's the key: associate new information with something you already know, like the patient you've seen, a simulation you've done, or even personal experience. The more you apply what you're learning to real life, the less you will need to rely on brute memorization. That's when pharmacology starts to stick. And one of the best ways to make pharmacology stick is to connect it to real nursing scenarios. And always bring it back to our two main questions. For example, when giving opioids after surgery, what does it mean for the patient? It means they are at risk for slowed breathing and may need reassurance and safety measures. What does it mean for nurse? It means safely monitoring their respiratory rate and O2 saturation, knowing the antidote. Or think about insulin teaching. For the patient, it means their greatest risk of hypoglycemia is when insulins peak. For the nurse, it means teaching them about eating at the right time, checking their blood sugar, giving snacks as needed. So instead of just memorizing side effects and onset times, you are anchoring the knowledge to real-world care. And by asking, what does this mean for my patient? And what does this mean for me as a nurse? You automatically shift from memorization to understanding. And that's what makes pharm stick. That's what makes the whole difference. AI can be a powerful tool for nursing students and for studying pharmacology specifically. You can use it to generate practice questions, simplify difficult concepts, create mnemonics, or even organize your notes into outlines and tables. But here's the caution. Don't trust AI 100%. It is not perfect and it can make mistakes. Even when generating NCLEX-style questions, it makes mistakes. Always double check against your textbooks, ATI, Lippincott Advisor, whatever you may be using, other reliable resources. So think of AI like a study buddy. It can save you time and give you new ways to practice, but the final authority should always be trusted nursing resources. Pharmacology is tough, but you are tougher. With the right mindset, tools, and consistency, you can master this. And remember, you don't have to be perfect. You just have to be safe and informed. This is the focus of our questions on unit exams and on NCLEX. We want you to be a safe nurse.